Please note that the individuals shown in this video are for illustrative purposes only and may not be actual healthcare professionals or patients. Thank you. Language disorders are complex conditions characterized by significant difficulties in the acquisition and use of language due to deficits in comprehension or production. These disorders can manifest across spoken, written, and other language modalities, impacting an individual's ability to communicate effectively, express ideas, understand others, or engage in social interactions. Language disorders can be developmental, appearing in early childhood as part of the child's overall language development, or acquired, resulting from injury or illness affecting the brain at any age. Developmental language disorder, DLD, previously known as specific language impairment, SLE, is one of the most common types of language disorders in children. It is not caused by factors like intellectual disability, autism spectrum disorder, hearing loss, or environmental deprivation, but rather is a neurodevelopmental condition that affects language skills development despite adequate opportunities for learning language. Children with DLD may have difficulty acquiring vocabulary, forming sentences, using correct grammar, and telling stories. Their challenges are not limited to expressive language but also include problems with understanding what is said to them, which can significantly affect their academic performance and social interactions. Acquired language disorders, such as aphasia, typically result from brain damage caused by stroke, traumatic brain injury, or other neurological conditions. Aphasia can affect any aspect of language use, such as speaking, understanding, reading, or writing, and varies widely in severity and scope. Some individuals may struggle with finding the right words, while others might have difficulty with comprehension or fluency. Diagnosing language disorders involves a comprehensive assessment by speech-language pathologists, who use a variety of tools and tests to evaluate an individual's language abilities in comparison to typical developmental milestones or pre-injury language skills. This process helps in identifying specific areas of difficulty and distinguishing language disorders from other types of communication disorders. Treatment for language disorders is highly individualized, focusing on improving the person's ability to communicate effectively. For children with developmental language disorders, early intervention is crucial and might include speech therapy, language-rich interactions, and educational support. For those with acquired language disorders, rehabilitation often involves speech and language therapy aimed at relearning and compensating for lost language skills. Effective management of language disorders requires a multidisciplinary approach, involving professionals, caregivers, and educators, to support the individual's communication needs in various settings. With appropriate intervention and support, individuals with language disorders can improve their language skills and enhance their ability to participate more fully in educational, social, and vocational activities.